Hi, I'm Dr. Erica Liu, part of the surgeon team here at IQ Laser Vision.
So after reviewing your diagnostic results, that means looking at your eye exam, your prescription, your hobbies, goals. We feel that you're going to be a great candidate for SMILE. And what that means is that there's very low chances of any significant complications and that we'll be able to achieve great visual results that you and we want for you. So the procedure itself is super fast, but it is a very strange experience. That's because it's a little bit unnatural. We're asking you to keep your eyes open when you want to keep them closed. The good news is that each eye takes a very short amount of time. We'll bring you in, we'll give you eye drops, numbing drops, antibiotics, and we'll be helping you open your eyes with a lid supporter. We'll be doing one eye at a time, and each eye takes about 5 minutes each eye. You will feel things during your procedure, but you're not going to feel any pain. Throughout most of the procedure, if you do need anything, you can talk to us, but we do recommend not to move suddenly, not to reach up, and just try to focus on your breathing and your surgeon's voice. So we're going to start with one eye, we're going to tape the other eye closed, but you do want to try to keep both eyes open and relaxed. There's going to be some bright lights during the procedure, but if you keep looking at them, you'll kind of get used to them and they won't seem as bright as when they first come on. There will be a blinking green light for you to fixate on for just a small part of the procedure, and then you're going to feel a little bit of pressure, which is going to be the most important part of the procedure. Will take about 25 to 30 seconds. That's the only part of the procedure where there's no talking, no moving, and just kind of zoning out and looking straight ahead. After that part, then you only have a couple more minutes. We're going to move the bed slightly, and then there's going to be a really bright light for the next couple minutes, and the whiteness will slowly disappear, but it's still going to be really blurry during that time. If you do need more numbing drops or need anything at all, you can talk to your surgeon, but again, that's just a couple minutes. And then we just do the same thing for the other eye. You're gonna do great. Just focus on your breathing and let us do all the work for you. It's best to try to relax your face and eyes as much as possible. And trying to keep your eyes open during the procedure, there's always a small chance that you'll move involuntarily or squeeze your eyes really significantly, but we will be helping you open your eyes with a lid supporter. Most of the time, if you do that, we can just restart the procedure. On rare occasions, we do have to switch to another procedure like LASIK or PRK, but oftentimes we can just restart where we left off. So just try your best, and even though you can't tell what you're doing, just try to focus on your breathing and just zoning out and looking straight ahead. So it's very rare for anybody to feel any significant pinching or pain or stinging during the SMILE procedure, which is why we love it so much. You will feel things. We can numb the eyeball. You'll feel some tickling, some pressure, but you shouldn't really feel any pain. Absolutely. So it's totally normal to be nervous before your procedure. We do like our patients just a little bit nervous because it helps them keep nice and still and we get you in and out and home really quickly. But of course, if you feel very, very anxious, or if you know that you've had any history of fainting or passing out, we can definitely give you something to help you relax. You can also take that when you get home to help you sleep and keep your eyes closed and speed up your healing. So recovery from SMILE is pretty easy. There's still a recovery period, and you will still need somebody to take you home after the procedure because your vision will be blurry, and you may have taken some relaxing medication as well. But typically, the first day, it'll be hazy, like looking underwater. You might have some irritation, so we do want you to sleep through initial recovery period, but the next day, people are able to do everything they need to do without glasses or contacts, working out, going for walks, etc. So that's typically what we do expect. Usually a little hazy vision, especially for the first couple of days, but that usually gets dramatically better over the next couple weeks. And it does take about 3 to 6 months to fully stabilize. So typically after 24 hours, you can resume your normal day-to-day activities, including showering, washing your face, going to work, working out. We do prefer that you don't swim for a couple days just to be extra safe, but usually the eye heals very quickly and people do great. So prior to your surgery date, you will attend a pre-op appointment, at least one, where we do a full eye exam, checking your prescription, making sure you're a great candidate for the procedure. And then usually we do see you one day after the procedure, and then 1 month, 3 months, and 1 year afterwards. Of course, if there's any issues, we can see you more frequently, or if you need to be seen more frequently, we're happy to see you. So the vast majority of our patients can attain the same vision they have with glasses or contacts, without glasses or contacts, and stabilization after 3 to 6 months. So that is what we expect for our patients. However, each individual is a little bit different, so we cannot guarantee any results. About 0.2% of our patients do need another laser procedure to get the results that we want, but that is obviously quite rare. So the SMILE procedure is a permanent procedure. Typically, we want to make sure that your vision, your prescription is stable before we do the procedure. And typically once that happens, it stays stable for a very long time until our 60s. That's what research has shown. So once we do the procedure, your vision for distance should stay stable until then. So it's very common for people to, especially right after the procedure, notice that kind of that glow around the lights at night is more noticeable right after the procedure. That is a normal healing part. And every week that continues to get better and better and better. And typically after 3 to 6 months, you'll go back to your baseline. Less than 5% of our patients have more than their baseline after 3 to 6 months. But most of those patients, it's still not very noticeable and doesn't really affect their day-to-day activities, and they're free of glasses. So that's something that most of our patients are okay with, that small increase in glare afterwards. So during the healing period, for that first week or two, it is very typical to have a dry eye sensation, or might feel like you have like a dry or old contact lens in the eye. That's part of the normal healing process. That's why we do tell you to use lots of artificial tears during that time. And then as you start to feel better, which is typical, you can slowly go down on those artificial tears. After that 3 to 6 months healing period, once the eye stabilizes, usually, again, patients go back to their baseline with that glare and halo, and also with the dry eye sensation. SMILE, LASIK, PRK, these laser surface procedures have been around for a long time, 20 to 30 years. SMILE is new, but it's actually still been around for about 15 years. And long term, we have not seen any unforeseen changes or complications that have kind of popped up. Long term, it's been shown to be really, really safe. And for most patients, their biggest regret is that they haven't done it sooner. So following your exam and scans, you'll be meeting with your vision correction specialist, who will be going over when you can schedule your procedure date, and also payment plans such as your FSA or any sort of insurance discounts or our financing, and go over the costs and the details and logistics with you in more detail.